Dear friends, dear brothers and sisters, good morning. My name is Dr. Jason Mitchell, and today I want to talk to you about something many of you are going through in silence. Over the past 25 years of practicing medicine here in the United States, I've heard countless stories, so much hidden pain. And the question that keeps coming back, the one many patients can barely whisper, is this. Doctor, why do I lose my erection right when I'm about to penetrate? What's wrong with me? My brothers, let me tell you something right away. You are not alone. In my clinic, I've seen men of all ages, from guys in their 30s to fathers in their 70s, struggling with the exact same issue. This is not something to be ashamed of. It's not weakness. And most importantly, there are real solutions. Today, I'm going to explain everything to you. The real causes, the solutions that actually work, and a clear action plan, not just a random list of tips. Because this problem doesn't just affect your body. It affects your confidence, your relationship, and how you see yourself as a man. I've seen marriages suffer. I've seen men withdraw, avoid intimacy, and live in fear of failing again. But I'm here to tell you this. With the right knowledge and the right steps, you can rebuild your confidence and your intimate life. Let's start with understanding why this happens. Before fixing a problem, we need to understand it. In my experience, there are three main categories of causes. 1. Physical causes. Your body works like a system. When one part is off, everything is affected. The has-own issue I see is poor blood circulation. If blood doesn't flow properly to the penis, erections won't be strong or lasting. Conditions like diabetes, which damages nerves and blood vessels, high blood pressure, which reduces blood flow, low testosterone, your body's fuel for desire and performance, heart disease, certain medications for depression, anxiety, or blood pressure. All of these can play a role. 2. Psychological causes. Let me tell you something I've learned after decades in practice. Your brain is your most important sexual organ. If your mind isn't at ease, your body won't follow. The most common issue? Performance anxiety. You're afraid to fail, and that fear actually causes the failure. It becomes a vicious cycle. Other factors include chronic stress, work, finances, family pressure, depression, which kills desire, past sexual trauma, relationship conflicts, and unspoken tension. 3. Lifestyle factors. How you live every day matters more than you think. Too much alcohol, smoking, poor diet, too much sugar and fat, lack of exercise, obesity, poor sleep, excessive pornography consumption. These all affect your hormones, your brain, and your blood flow. Now, what should you do? Ask yourself honestly. Do you have a chronic illness like diabetes or high blood pressure? Do you take medication regularly? Does the problem happen all the time or only sometimes? Do you still get morning erections? If you do, that's actually a good sign. It means your body is working, and the issue may be psychological. A common concern. One patient once told me, "Doctor, high blood pressure causes erectile problems, but the medication does too. So what am I supposed to do?" That's a real concern. Here's the truth. Not all medications have the same side effects. Newer options are much better, Lifestyle improvements can reduce medication needs. And medications like Viagra or Cialis can safely help in many cases under medical supervision. You are not stuck. There is always a way forward. Let me share two real stories. Names changed. Michael, 50 years old, a small business owner. No illness, but extreme stress, financial pressure, poor sleep, anxiety. We worked on breathing techniques, communication with his wife, reducing pressure during intimacy, temporary support with medication. 2 months later, everything changed. His confidence came back, and so did his relationship. Robert, 61 years old, diabetic for 10 years. His condition was poorly controlled. He was overweight, inactive, and still smoking. We created a plan. Better diabetes management. Class. Weight loss goal. 30 pounds. Daily walking. Quit smoking. Medication support. 6 months later, he lost weight. His health improved. His erectile function improved by 70%. Concrete actions you can start today. For your body, eat better greens, nuts, fish, lean protein. Exercise 30 minutes, 5 times a week. Strength training 2-3 times a week. Do Kegel exercises daily. Sleep 7-8 hours. Quit smoking. Limit alcohol. For your mind, practice deep breathing before intimacy. Reduce stress. Talk openly with your partner. Example: hey, I've been dealing with something physical lately. It's not about you. I just need your support. This changes everything. Very important. Reduce pornography. It rewires your brain to unrealistic stimulation. Real intimacy starts to feel not enough. Take a break, you'll notice the difference. Medical options. PDE5 inhibitors, Viagra, Cialis, Levitra. Testosterone therapy, only if medically needed. Vacuum devices build. Surgery, last resort. Always consult a doctor. Natural support as complements. Ginger, ginseng, maca root, L-arginine. These help, but they are not replacements for real treatment. Be patient. Lifestyle changes 3-6 months. Medication, immediate effect, but needs adjustment. Therapy, 8-12 sessions. Kegels, to 3 months for results. Progress takes time, but it works. Final message. Losing an erection during penetration is frustrating. It can hurt your confidence deeply. But listen carefully. This is not the end. There are solutions. There is hope. And you can recover. I've seen hundreds of men go through this and come out stronger. The key is, don't stay silent. Understand the cause by. Take action. Ask for help. You deserve confidence, a fulfilling intimate life, a strong connection with your partner. Start today. See a doctor. Change one habit. Talk to your partner. Small steps lead to big changes. You are not alone. Take care of your health. Take care of yourself and keep moving forward. Stay strong.